Welcome to Ketobiography. I'm your host, Robin Dobbins. Today's guest is an award-winning investigative science writer whose work has redefined self-help genre into what she calls science help. Through her research and writing, she's shown how evidence, not opinion, can guide us towards better well-being, especially when conventional medicine falls behind the science. Her latest book, Going Menopostal, dives deep into what really happens during menopause and perimenopause, exposing the alarming disconnect between medical training and the actual evidence, and showing how we can close that gap to reclaim our health and sanity. Please welcome Amy Alkon to Ketobiography.
Thank you
Hello
so much.
and welcome.
Hi, I love your spirit. You're the best.
Well, thank you. I've been looking forward to having this conversation since actually before I invited you to come on. So I'm glad we finally get to meet each other and to talk. And I'm just very excited. My audience doesn't know this, but I read your book, and I'll pull it right here. It's right behind me, Going Menopostal. And
I
this is
never tire of
after
this. I'm never
I
jaded by this. I'm so excited. Thank you.
it changed everything. I have been, let me just tell you a little bit about what has gone on with me in the past year. October last year, I started getting the hot flashes that one lit off the other, like I was chain smoking. And it was just the most awful experience. I went to a doctor who would not prescribe anything but testosterone and wanted to do pellets, but I had read enough to know that pellets would
Oh,
not be a good choice, so I
oh my
refused it.
God.
But went on a cream which made me bleed for 2 months straight. Sorry,
Which cream?
everybody, you're
Which
getting
cream? Oh no,
a
this is
testosterone.
important to talk about this. I'm from Michigan and I used to be the person who would like never say period at a part. Now I'm like, you still menstruating?
Yeah, yeah. So that was 2 months of testosterone cream, and it was god awful. I finally had to call and say, "This is ruining my quality of life. What can we do differently?" Which just turned into guesswork, no blood work, just guesswork.
This is
And I was at
terrible.
my wits'
Mm.
end, and then I saw the name of your book and a post on social media, and I immediately pre-ordered, and when it came it was like Christmas Day, and it changed everything. It empowered me to change my doctor, to have an honest conversation with my new doctor about what was going on. And anyway, I'm doing all the talking. I wanted to take it over to you
Oh
to,
no,
because
this you have
I
no
think
idea.
you're, I know from
My
reading your
heart
book
is
that
like
your story.
you say that my heart, like author heart, like little wings going like, oh, this is why I wrote the book.
It
This is
did
like,
what it was
no,
supposed to do for me, and I have recommended it ever since, because
thank you.
that's exactly it. Like I don't have, like, this thing happened to me, and I was like, I need to find out more, but I didn't have what you have in this scientific investigative mode that you can get into to really dig deep. So it's a personal story, but it's also a very science-based story, and that really resonated with me. And just like I said, it changed everything. It changed how I decided to go about treating us.
Thank you. And actually, I wrote this because I got evidence-based care for myself because I'm a seriously terribly annoying person. And I use that now. I weaponize being annoying and, I use science. And I got what was evidence-based care for perimenopause. This is the transition years to menopause, like 3 to 10 years. Some women are not symptomatic. I was one of the ones who have horrible symptoms. And a lot of them you don't even recognize as perimenopause. For example, I started getting newly car sick. I used to get sick looking at a dock when I was like 8, and then you grow out of that. And then 46, I drove from, so I live in Venice. Santa Monica is like 2 miles away, and it's straight here. It's flat, Venice to Santa Monica. I went and I went to Santa Monica. I threw up in my shoes. This is so horrible. And so what happened was, I have been coached since 2007 by an epidemiologist and biostatistician, Sandra Greenland, who is behind reforming methodology in medical science, and also the thinking, the overconfidence, and he's also about embracing the uncertainty in conclusions. So we're much more careful with this, with his way of going about science. And this was a huge influence. He's very generous. People in his position, they're not going to spend all this time. He spent all these years, get my column every week. I wrote a syndicated science-based column. Papers went out of business. I had to stop, but he would criticize it. It's like your dad being disappointed in you. It's so horrible. But no, he said the book is the best thing I've ever done. He endorsed it on Twitter or whatever it's called now, X. And so because of what he showed me, not only did he show me how to evaluate the science, but he also sent me over the years many, many studies and news stories, and we would discuss the fraud and errors and abuse in medicine. Now, doctors, they're not sociopaths. There are a couple in every profession. They want to help you, but they are not trained in medical school in how to read research and evaluate it. They don't know how to read studies, most of them. Some learn on their own. They're not trained in diagnostic reasoning. So Dr. House is not home. And then unless they train themselves, and that's unusual. And then the last one is that these are the 3 myths of our medical care. They are not able to correctly calculate your risk. So they will use pharmaceutical reps handouts and everything with this overstated risk. Oh, if you use this, you will be, like 75% less likely to get breast cancer or whatever. And they're actually phony statistics. They're real numbers, but they're not about your risk. They're about, the epidemiologists, public health people, when we compare this group to that group, well, why do we care? This has no bearing on us. So I read all the science before I go to the doctor with a problem. And I do this in the perimenopause area because I got a hot flash. Venice, California, it is like 55 year round. I'm sitting at my breezy desk, and all of a sudden I am locked in a car trunk in the Everglades. And I thought, I think this is a hot flash. I call my mother, Mom, like, how long did those last? She said, I think till I was 70. Okay, Mom, no. Okay, thanks. Goodbye. Anyway, so I read all the science, and I see this just really massive gap between what the science says and what the practice standards are. And so I ask Kaiser Permanente, I go to my provider, and I say, look, here's the science. I would like to get not the drug you give. This is perimenopause. So your problem is not that you're low on estrogen. Doctors wrongly believe that you're not low on estrogen in perimenopause. It's not this like sand in an hourglass menopause light, but you tend to be low on progesterone, which is the second hormone of the menstrual cycle. And the way progesterone gets made is that the estrogen rises, you have a little egg follicle in a sac, and that ruptures, that's ovulation. And when that sac ruptures, the litter left over, this yellow waxy stuff called the corpus luteum, progesterone gets made out of that. Now, this is very important that you ovulate, and because progesterone, it potentiates GABA and peace and sleep and mental wellness. And without progesterone, it's basically like those car chases we have here, the rims on the freeway. That's how you feel. You're wired. I was just inexplicably angry and hateful all the time. And I like people. I talk to everyone, and there was a guy humming in the hardware store behind me. And I turned around, he looked like my dad. And normally be like, oh, my dad, and caulking in his hands. The moment he starts humming, I wanted to murder him. I mean, this is horrible. I would like to say I'm not, violent. I'm just hostile. So anyway, Kaiser, they turned me down. They're going to make me pay extra and for the progesterone, it was substantially more than, this was back a number of years. And they give you the drug on their formulary was medroxyprogesterone acetate. And so this drug binds with the wrong receptor in the breast, increases your risk of breast cancer. It is harmful to the cardiovascular system and the brain. So wait a second. I could have oral micronized progesterone, FDA-approved drug that is the same as a progesterone in my body, and progesterone rises to 10 times or more the menstrual cycle amount in pregnancy. So we do not have pregnant women dying of progesterone. And so this is actually, it is such a wonderful, healthy hormone, but you wouldn't know it if you read the FDA package insert because it's actually not for progesterone, but medroxyprogesterone acetate. So anyway, I fight 3 battles armed with science. And I finally get Kaiser to give me the drug, give me the amount I need, which is the amount they take in France, 300 milligrams. Here they give you 100, 200 for no scientific reason. That's bad because you're not protected against breast and endometrial cancer. And then I get them to cover it. So because I'm a naive Pollyanna dipshit from, sorry, I hope I'm allowed to say that, from the Midwest, I say, well, of course, I've shown you all this science, it's strong, and the physiology and everything. And so will you put this on your formulary for all the other patients? And I was like, hello? Like, no. And so what I saw was that I got a drug that helped me, that alleviated my horrible insomnia, my horrible hot flashes. They weren't gone, but I wasn't like, I volunteer as a mediator. I wasn't in mediations with my mascara running down my face, like I had been crying for an hour, and I just was standing there, like listening to people and keeping them from, abusing each other verbally. And this is so egregious. So it would be like for me to do nothing and not write this book, which was it's the most terrible and important thing I've ever written. It would be like watching women from across the street all walking into an open manhole or a trench, falling in and saying nothing. And it's not moral. I couldn't not do it. And so I spent 8 years. I lived off my savings because I'm a fiscal moron. No, because this was just too important. And this book, when I got your email about this, and when I hear this from women who take screenshots of the book to their doctor, who are able to test themselves to see if they're low on progesterone, based on, it's called QBT, quantitative basal temperature taking. This is originated by the endocrinologist Geraldine Pryor, amazing, fierce scientist, UBC. She is the one who put progesterone on the map scientifically. It's been ignored by all these researchers, and perimenopause is a hormonally unique state. She's amazing. And her research sort of gets neglected and ignored by many in the field because she's not part of the clique. It's not what everybody believes. And these are the people who had us not taking estrogen because the fraudulently announced Women's Health Initiative study, terrible methodology, they harmed all these old women. They gave great grandma estrogen. You're 79. If you take estrogen when you're broken and unhealthy, it will make you unhealthier. It'll harm you. If you take estrogen right upon menopause as a healthy woman without cardiovascular, risk, like a plaque in your arteries, that's reached a certain level. Many people have some plaque, but if you take it as a healthy, just menopausal woman, it can protect you throughout your lifespan. You need to be monitored, but you need to be taking it at 79, contrary to what some doctors today will tell you. If you're not taking it at 79, your bones are not protected. If you stop taking it at 60, like the head of Kaiser Gynecology, West LA, Big Kaiser, she told me several months ago, oh, you're taking estrogen. I'm 61. You need to taper off at 60 because it can cause Alzheimer's, blah, blah, blah. I was like, okay, we need to get you a time machine because this is circa 2002. Discredited research, discredited by 2004, and subsequently discredited some more, that was based on giving elderly, broken, unhealthy women estrogen, and then announcing their results as if they applied to just menopausal healthy women, which they did not. And they caused just a huge number of women to throw their estrogen out, to become less healthy, because estrogen protects your cardiovascular system, your brain, your bones, and it does many, many things throughout your body, helping you maintain a healthy weight. It's not a weight loss drug, but it helps you not have what's called menobelly, which is like you got a beer gut all of a sudden. And I realized your body changes in perimenopause and menopause, and suddenly I always had a big badonkadonk butt, and suddenly I have this small, cute butt, and I was sort of like, wow, look at that, and then I realized I just had a fat redistribution. I had a butt gut. My fat came to my belly. It was really upsetting. I had a flat stomach my whole life. I could eat I could weigh a lot, and I'd still have a flat stomach, but just hips out to here. So anyway, I'm talking too much. I should let you ask questions. I'm so appreciative of being on your show, and also the keto the whole keto lifestyle and science and everything you promote, because it's so vital for health. And it's one of the things I write about in the book is how we live to, have longevity, not suffer, be ourselves, just a little more wrinkled.
Well, exactly. And I think that this is an important topic because it often gets overlooked. But if we're looking at science, at studies, a lot of times, not in the case of menopause studies, but it's studies in general are done on like this male population. And then they just say, it applies to everybody. But then also taking all these older women who've already gone through menopause and not looking at the fact that it's a whole different physiological state when you're going through perimenopause to menopause. That it's a whole different thing. You can't apply this one thing to the other and just make this blanket statement for everyone. And I just think that goes around in a lot of cases, not just here for perimenopause. But that brings us to like the myths, and I know that that's an important topic for you. So like I said, I just kind of went through this process myself, and I know a lot of women who are going through it also, and they just don't know like what questions to ask and what to believe and what not to believe. So I think it'd be really good to kind of talk about those things, what kind of the current thinking is, because they're looking at those studies from the early 2000s to where we kind of should be. What can we kind of, what myths can we bust today?
Well, I'll tell. So there are a few things that are important to know. There's 3 myths about our medical care. There are a number of them, but these are the main important ones to know. And one is that we believe that doctors make decisions about our care based in science. And in fact, they do not, because doctors are not trained in medical school to read and critically evaluate science. This is so terrible. So they don't read science because they don't know how. I document this in my book. This guy, he was this doctor asking all these young doctors about this, and none of them had read. They didn't even look at the titles of articles in the New England Journal of Medicine, which they get for free at their office. I mean, this is amazing. And so your doctor's not making decisions based in science. They're practice standards, lists of what you do. And so this is really bad, because in order to correctly diagnose someone and to understand their problem, you need to understand physiology and to hold the science up to how our body works, to how our, the chemistry, our mitochondria, very important for potentiating energy in our cells, but more than that. And doctors don't, if you ask a doctor about mitochondria, this is the thing that I think all of us who look at ketogenic diets and these, this area of how do I live to be at my healthiest rather than being medicated out of my unhealth, we're at least getting a sort of passing glance at mitochondria and other important substances, and looking at insulin resistance, and how do we prevent, insulin resistance and inflammation and inflammaging, which is a broken insulin response. So I should get on to the other 2 myths of our medical care, which is that doctors are trained in diagnostic reasoning, and they are not. There are very few medical schools. There's a guy named Mark Graber who's behind trying to get this into medical schools. But medical schools, they are so morally bankrupt. They know nobody knows this. Nobody knows about the lack of science education. Their doctors are scientifically illiterate, most of them. And so they don't bother to change their curriculum. And the same thing goes with the other myth, which is that doctors can correctly calculate your risk. If I take this drug, what is my risk of getting this disease or of being harmed? And they can't do that. And it doesn't take genius to learn. And in fact, I'll tell you how you do it. You can all do this if I describe it. Natural frequency. So if percentages, we humans didn't evolve, like rock didn't have, 30% more, no, none of that. But what we see are, here are people, and then how many of these people? So you draw 100 people on a sheet. Okay, and you color in how many will, have this effect and that effect, how many will die. Okay, color in those, and then wait, let's take you into account. Okay, you have these diseases, or you're this healthy. So if you're this healthy, we're going to erase, a person and a half of the like dead people. And so this is your risk. And you can understand that any of us can see on a sheet, there are like 26 people colored in. Do I want to do this? And so a part of do I want to do this is something doctors do not do. It is against law and medical ethics, and it is to give you informed consent. You need to know, why are they giving you this drug? What's your condition? Why are they giving you the drug? what are the adverse effects of the drug? What are the benefits they're looking for? How likely you like to have the benefits? And what happens, can you go without the drug? What happens if you go without it? Or is there another drug that is less risky? I have just had this, I'm a medical expert. I caught all these things. I just had a corneal endothelium transplant. This is this little one cell layer in your eye. I have a genetic disease. It's called Fuchs dystrophy. And you can better believe I say that the bad way when I'm not on a podcast. So I got this tissue replaced. My doctor, she knows very little about the drugs she prescribed. I was given no informed consent. And so I ended up reading the research in her field. Normally I read always beforehand. I had so much to do. I needed to get something done in my book. It was like that. I basically worked till like I fell into the car and then fell into the gurney to get my, the Exacto stuck in my eye, as I describe it, because I'm a couth and genteel person. So she tells me prednisolone acetate, the steroid, does not have systemic effects. Okay, this is such a well-documented, this is not like a controversial. Of course it does. It's very systemic. And corticosteroids, they are harmful to your bones. They can increase your risk of diabetes and metabolic disease. They're really terrible. If you can avoid them, all these doctors, let me give you a cortisone injection. Okay, if I'm not like, writhing on the floor in pain, I'm not getting a cortisone injection. And this isn't medical advice. This is just me, because I prefer to avoid these risks. So what she doesn't tell me, because she doesn't tell me it's systemic, to occlude you have to keep it from going into your tear duct, because that nasal mucosa transmits everything. So all of these things I'm not told about these drugs, about the harm. She tells me the wrong thing. And so I don't have any sort of chance of saying, wow, is there another drug here? So I end up changing myself to another drug, Lotemax ointment, that's less systemic. I ask her, she's miffy about it too. It's like, okay, I'm having tachycardia and bradycardia every day. Maybe we could like not have that happen. And then the drugs for the antibiotic, it has a back preservative in it, which means benzalkonium chloride. And I'll get off this because it's the eyes instead of menopause. But these drugs, they erode the corneal epithelium in a matter of days. They stop wound healing. Okay, I have a transplant. We want to stop wound healing. Oops, I forgot. I have one finger. Sorry. Flawed Amy Alkon. Hi. I'm 61 and I have 3 fingers.
Yeah, just do like this. That's fine.
Yeah, you're right. The nail polish, no nail polish on one. Sorry. I was like, you try to hide those, and then you forget that you're okay. Never mind. So anyway, this is the stuff that goes on in every area of medicine. This doctor, by prescribing me the antibiotic she did, it's called a fluoroquinolone. If you ever get ofloxacin, moxifloxacin, ciprofloxacin. These are really horrible drugs that can cause you irreversible tendon damage, neuropathy. I have all of these things now because I look at the sheet, I read everything. It just says I could have anaphylaxis. I'm not likely to have that. So I figure, okay, it's okay. What I didn't know is the class effect. A doctor must know this. So if you get the fluoroquinolone antibiotic and a corticosteroid concurrently, and you're over 60, there's a multiplied risk of tendon rupture from routine movement. Like you reach for the coffee mug. Achilles tendon, 46-fold increased risk. She owed me, the disclosure of this, and she didn't do it. So this is negligence, malpractice. It's really horrible. And so now I just joked with Robin before I came on that I'm going to rob the Louvre but with just my left thumb, because I have no feeling in my fingers and toes right now. This is called neuropathy. It's so dangerous. And so I was curling my hair and I just left my finger on the curling iron and I realized, oh my God, so I don't have a fingerprint there anymore. I don't want to steal from the Louvre. Besides, I wear $2 earrings. So, anyway, so I didn't answer your question about perimenopause. I guess I should get back on track, but it is just so important for people to recognize how little evidence is behind our care, and doctors aren't evil. They're not trained. And in the menopause and perimenopause area, guess what? Almost none of the doctors have any experience or training in menopause or perimenopause. So it is a violation of medical ethics for them to treat you, but the gynecology departments have them do that. It's business as usual. And, I would feel this a huge responsibility, but I'm not everyone. People want to go home at night, and I just read science day and night because I'm a weird nerd. But other people they have families. and they want to have like a life beyond the office and medical care. So you can't begrudge them that, but the institutions like Kaiser Permanente owe it to us as patients to backstop what they lack in knowledge and scientific ability, the scientific method that they're not trained in med school, to have experts there, telling them about here's the risks of the drugs and everything, and they don't, and that is a fault of these institutions. And you need to actually get the informed consent from your doctor yourself. You need to trigger it yourself. What are the adverse effects of this drug? Are these all the adverse effects? What if it's combined with other drugs? And look up adverse effects like you're a maniac on the internet. Look them up and then look up more and look up more. And don't just look at Healthline. With these sites, a lot of them have just false information. Look to studies and things. Even if you can't understand the whole study, look for adverse effects. Look up adverse effects and you will see some things there. And some of them might be rare. And, you have to look at a few places to see, but, that way you will at least know to ask your doctor, hey, I saw this, isn't this a risky drug? Is there another drug I could take? And in my case, the antibiotics, the FDA says, do not prescribe these fluoroquinolones unless it's dire need, the person going to die. If you're a homeless person with resistant TB, we might need to give you ciprofloxacin. But if you're Amy Alkon, I'm metabolically healthy, even though I'm a grease licking pig. Really. I'm a carnivore diet, and that you don't give a patient like me, the like overdose of steroids and all this stuff I got, and the doctors, they're not telling you this. So anyway, I'm going on too much about this because I wanted to get into the difference of perimenopause and menopause. You asked me a question. I know I forget what it was. And so, I hope this
well, you
helps
kind
people.
of cover all of it in one
Yeah.
thing, because we put a lot of trust in our doctors, and it's hard to, like, we were taught that, right, as kids, like the doctor's the smartest person in the room. You go to the doctor, you ask, they know what's best for you. That's what they train for. And so to come to this realization that it's not really that way, and it doesn't mean that they don't care and they don't want to know, they don't have time to know, or the ability, to read the studies, to understand all that stuff, but we just kind of assume that they do, and we've got to break that, like reverse everything that we already know and start asking questions and be our own advocate. And I think a lot of people, especially when they're sick, they're exhausted, right? They don't
Yeah.
have that energy to ask all of these questions. So for me, a book like yours comes along and I'm like, oh, now I know kind of the questions that I need to be asking, or the treatment, the possibilities that are out there beyond what the traditional course of action may be. So that's what my question really was like this myth between kind of the standard of care, because being in perimenopause isn't an illness, it's just a change that's happening physiologically. Like all of women are going to go through it, some more abruptly than others, some with more anger than others, but it's not an illness, and there's treatment. And I know for me, like, I was like, oh well, this is just a natural state, I should just let it run its course,
Oh my God. This is the
until I
natural.
had those hot flashes, and then I was
Right.
like, I
Right.
need information now.
Oh, I know. It's the naturalistic fallacy, the idea that something is natural, it's good. And
Yeah.
I break company with both Geraldine Pryor and then the late Susan Love, where they think, oh, it's so horrible. Menopause is called an estrogen deficiency disease. Let me just tell you, yeah, it is. Menopause, as a person with ADHD, so you have low dopamine and norepinephrine, and ADHD is not a deficit of attention. I have like 36,000 squirrels running in my brain, and Adderall and modafinil help them sit down so I can focus. Unlike people who don't need this stuff to help them in this way, people clean their house for 3 days. Oh my God, I wish there's a covered mess here than the black, but I slow down and I can actually take Adderall, modafinil, 2 caffeine pills, and drink strong coffee, and then take a nap. So it's different. And so the different drugs affect people differently. And one of the things that will eventually start to become part of our care, and should be, is pharmacogenetics, which is how your genes and drugs interact. And this is really important because do you metabolize this drug very quickly? So maybe you need more of it, or different drugs will be seen to work because of your genetics. You'll have that information, your doctor will, and this just isn't done. Doctors don't know because they're not really reading the journals or anything, and not really reading the scientific information. And so you said something, now I forgot to head on what you said. The disease thing. Okay, I was so sick. There are like 15 or maybe 20% of us who get extraordinarily ill during perimenopause. Me throwing up. I mean, I talk fast normally, but I talk like an insane person. Like you would want to run from me because maybe I would stab you. I would be like, and I couldn't control it. And the thing is, testosterone actually, I have very low free testosterone, and also estrogen, because here's the thing: when you eat a carnivore or keto diet, you have something in your body called sex hormone binding globulin. That's a bind. It's like S&M. Sorry, I always have to go there. Actually, the first time I've ever gone there, but it just occurred to me. So what happens is this binds up steroid hormones. Estrogen I take, and not the progesterone, because I do something to sort of make that, like to potentiate it, but it's not going to work for everyone. I'm not going to say, but most people are not going to have as high SHBG as I do eating a strict carnivore. And so I have this, I'm not going to eat carbs to bring it down, which you can. And so I get less than half of the steroid hormones I take. And doctors like, look, here's the evidence. Here's my free estradiol test. You have to special order that often. You need sensitive testing, not the kind that Kaiser gives you a test for testosterone that's for men. It is so crazy. And so taking testosterone has really, really, really helped me in terms of my attention. Now, it's not supposed to be for this. You have to actually say you have sex problems. Oh, in like 6 months. It's called HSDD. Hypo is not enough, sexual desire disorder. And I'm not telling people to lie, but the thing is that there are certain things that they'll give this for that's barely doable, and they make you pay for your estrogen or your testosterone because it's not one of the proved things. But it has been so helpful for me, with my ADHD. It made a huge difference. And then, energetically, sexually, women will have a problem with a lack of feeling their clitoris. I can never say that right. Also there are vaginal dryness issues and everything that estrogen helps. But the testosterone, it does really help some women. And it's egregious. So you were talking about the different ways they prescribe this. Okay, the pellets, these come from these like practitioners who are, you don't know what's in them. This is terrible.
And you're stuck with them for 3 months. So if you have an adverse reaction to it, you're stuck for 3 months.
Here's the other thing. Kaiser Permanente, they give women androgel. Okay, this is testosterone for men. And when I say for men have 20 to 25% thicker skin. This is a gel, and more sebum, more oil. And so that doesn't assimilate properly. It's not designed for a woman's skin. And so women should have compounded, and that's a whole other problem, compounded estrogen cream in what are called oral syringes. These are very precise doses. So the FDA controls medicine. They want to make sure when the FDA regulates drugs, they go inspect the factories, except in India where they say, oh, we're coming. So like paint over the room with all the bacteria and the Viagra and the estrogen,
and we're going to treat you like a king when you come to inspect us, and you're not going to notice any of the things that are going on.
Yeah, exactly. Avoid drugs from India. Call and see where your drug is made, and ask them to give you a different generic if you're getting one, because the drug industry is so corrupt and terrible. Yeah. And so the testosterone, so that's the best cream for women. They're called oral syringes. They're not oral, and you don't inject them. But for a compounding pharmacy, this is also this like wild mess. People are compounding pharmacy. It's their garage. Like, oh, let me not get the motor oil in your cancer drug. And so you need to go to an accredited pharmacy, really check them out. this is very, very important. And so when I got, if you're getting a drug, some drugs you might need to have extra sterile. They have to have a chemo, they have to have a cancer special room. They'll open it like one day a month to do these extra sterile drugs, like for eyes and things. And so this is a big deal. You've got to go to one that's really good. And still, even then, with any drug, with the FDA approved drugs, they could be there. We have all these occasions when they're not what they're supposed to be and make people quite sick. So
again, putting that trust out there that the machine has our best interests in mind, and that's really not the case at all.
Oh yeah. And sometimes it's, with pharmaceutical companies, it's often just straight out greed, usually. And I'm not an anti-business person. I'm libertarian. I'm not some kind of like, what is it? What they say, like overturn the system in America. I forget what they're saying, death to America, all that other crap. And it's like, wait, you're going to replace capitalism with what? Like, oh, communism, like, we're going to starve the whole more, I can never say that, it's been tried and it's really, horrific for like bloody millions of people, tens of millions slaughtered. Anyway, so I'm getting off the topic with all the slaughter and everything. We were talking about, I think, perimenopause, like the unique state. Perimenopause, I should get into that a little bit. So perimenopause is the transition to menopause, 3 to 10 years, miserable for some of us, and doctors will prescribe estrogen, which is exactly what you don't need, because women, it is extremely rare. Women might have some kind of rare condition, but women don't lack for estrogen in perimenopause. In fact, estrogen tends to spike, sometimes to 3 times normal levels. And then we lack progesterone if we don't ovulate. And so what's so wonderful is this quantitative basal temperature taking I put in the back of the book from Pryor, Dr. Pryor. This allows you to use just a drugstore thermometer, collect legitimate medical data from your body. Okay, here's my temperature. And if you have progesterone in your body, if you have that progesterone cycle for an adequate number of days, you'll have a temperature rise. And this is all put in there. This is from the research of a guy named Rudy Vollman in the 70s who discovered this temperature rise. And so you can say, look, I'm not making any progesterone, or I'm making, I only have X days of progesterone. You should have 10 to 12, I think the number is. And if you're having sleep problems, progesterone helps sleep. Medroxyprogesterone acetate does not. They're giving that less now than they used to. And so how can your doctor deny you sleep? It's like, look, I need this. And if they give you estrogen, for many women, for a woman like me, where I had horrible spiking estrogen, that's like overdosing me on the thing that's making me sick. What, I need to like throw up all day, and not just when I get to Santa Monica, throw up in my shoes. I like my shoes too. This is horrible. And that doctors don't know the unique hormonal profile that they think perimenopause is menopause light. Oh, estrogen running out like sand in an hourglass, like that soap opera. No. And then also one of the things doctors don't know, they're all afraid of, many of them are afraid of prescribing hormones or sufficient amounts, because they are just going on this. I heard this about the Women's Health Initiative study, and this is discredited research, and they don't know the current, even not just the research, but they could just read the Menopause Society bulletins, which are kind of a little bit not, the most, up to date in the science that they think they are, but that say, look, there's not a stopping rule anymore. You don't have to taper off estrogen just as a matter of course, that we look at individual patient health, monitor patients throughout their lifespan. So you can take that. You want to be taking, if you can, taking estrogen when you're 75, because women, then that's when we break bones, we fall. And so that way, you have it's very, very protective. And these horrible drugs called bisphosphonates, like Fosamax, that my mother took, they make your bones more brittle and microcracked within 3 years. This is so horrible. Doctors don't know this either. They believe they're helping you. And what they're doing, there's a scam of bone mineral density. This is how much bone stuff you have in a single area. Okay, if you have a piece of wood and like 50% of it is sawdust, there's still like stuff there. It's not empty, but this is not good. And so what these drugs do is they keep around old, past its prime bone. like, this is not healthy bone. It's not bone quality, but they have these scans they measure you in, these scanners, DEXA scans, and bone quality is not measured. What they measure is what they can drug for, which is bone mineral density. And you can have high bone mineral density or low, and you can still break bones. And really, it just falls. That's the main thing. So if you're, don't be me. I have purple gardening clogs in the middle of my floor for some reason. I don't garden. I don't know. And I like trip over them. And so now I'm being very careful, especially with the tendon harm from the fluoroquinolones. I need to not fall. And I have no balance right now compared to my usual. I may have been debilitated for life. And I'm a medical expert, but I didn't know the class effect of these drugs. You shouldn't have to know that. I shouldn't have to know, investigate every nook and cranny. How would I have known? And this is the kind of thing that's happening to everyone, but they're less equipped to backstop their doctor's medical ignorance. And that's the problem.
And
We
you're
need
a person
to
who's very, very in tune to this, and this. Have an advanced knowledge of this. A regular everyday person that's not part of their world to do these deep dives like you do wouldn't even know that was out there, would never have known because the doctor never said anything. My story was that my dad actually told me about that problem with the antibiotics. I had no idea from the doctor that is a potential. Thankfully, not I didn't have anything, but it did make me stop moving for like 2 months. I just
See, isn't this
just sat
terrible?
there like I want to be wrapped in bubble wrap because I don't want this to happen.
Exactly. And so they harmed you because every day we spend sedentary is a day we're increasing our likelihood of insulin resistance and inflammation. And inflammaging, what that is, so if you eat a standard American diet and your blood sugar's on this seesaw with your insulin, like up, down, up, down, up, down, eventually in many people that breaks, to put it simplistically. But I think this is, it's easy to understand that way. And what happens is you end up having chronic low-grade inflammation. So you're on fire on a small level all the time. And so what happens is when you need an immune response, your immune system is so tired. Basically, state like, I have a hangover. You're not mustering the immune response. You need those little white blood cell warriors, all pert coming out and fighting the whatever it is. And so all of this contributes to massive unhealth. So then you'll have a problem from that, and then more problems and more problems. It snowballs. And a big part of the problem with all of our medical care is that doctors are not transdisciplinary. Because I'm this weirdo. I came to this, I did behavioral science-based advice, evolutionary science-based advice for years and years. And the medical thing was an accident. My joke is that I forgot to take endocrinology when I forgot to go to med school. I had to do this book responsibly. I had to learn all this stuff. I had a British med school textbook pasted on my bedroom walls. I'd rotate the pages, annotate them, swap in the new ones, study some more. This is my whole house. I don't have a lot of wall space. The shower also, I have a clawfoot tub, so a lot of room for the pages, and doctors are not doing this. And I feel, again, people want to go home at night, but I feel you have a moral responsibility when you're treating patients to really know physiology and everything, because that's how you check what's happening in them. Against the science that you also haven't read. And so you're not able to diagnose people, which means get to the root of the underlying condition. And so what happens a lot is what Randy Nesse, the evolutionary scientist and founder of evolutionary medicine, calls the viewing symptoms as disorders area. So viewing symptoms as disorders, they see, here's your symptom, they treat the symptom. Okay, so let's say you're having really bad headaches. Maybe you just have real poor coping skills and a lot of stress at work. Okay. And they give you some kind of thing, NSAID or whatever they give for headaches. I don't know. Because unless my head has if someone's putting a spike through it, I'm not going to take those drugs and just tough it out, breathe, whatever. And my morning will suck. But so they give patients something to stop the headaches. Well, what if it's not coping skills, but what if it's a glioma? So what you're doing is you're masking the signs that you need to deal with this in time. And then, it wasn't stress headaches. Oops, oopsie. And that doctor, okay, I hate you, doctor. You've, harmed me. I'm going to die now. But you're harmed. The point is, and this is the sort of thing that happens. This is the cost of the lack of education, and then also the lack of ability to do this sort of creative thinking of, okay, here's what's going on here. And then here's this. And when you're transdisciplinary, like I am, I had to learn cognitive neuroscience because actually there's a neuroscientist who's such a bad writer. I couldn't understand his papers. So I studied it for a year. And I did it for more than just that reason, but that's how it started. And so with the stuff that happened to me with my, these drugs, the corticosteroid and everything, I know about the HPA axis. This is your hypothalamic pituitary, I don't know why I always do that, pituitary adrenal axis, and your hypothalamus, you guys, you're in Florida, so maybe, Jewish for grandma's bubby. So the hypothalamus is your bubby. You hot? You cold? You thirsty? And it's, look, she's thirsty. Tells the pituitary, hey, get on this. Send some chemicals, around and get things done. So it'll tell your adrenal glands to, elevate cortisol, and cortisol is not pernicious, just if it's in excessive amounts and, chronic inflammation, all that stuff. And then, it'll do things like it'll send a chemical message to change things so you get more fluid into your, where it's needed. And then it'll tell you, hey, you're thirsty, go drink something. It sends you that message. It's an amazing, amazing system. And so knowing that, I knew the harm that was being caused by this doctor, with the reason I had tachycardia and bradycardia. Oh, and here's the other thing. You really cannot rely. I didn't even pick up on this. You can't rely on your doctors so many times to just do what's appropriate. A tachycardia is a dangerously high heartbeat. Bradycardia is dangerously low. I mostly had tachycardia. So I show her, I had 177 beats per minute while sitting on my couch. I'm highly rational. I'm not like, oh my God, the sky's falling. No, I'm just sitting there. And at one point I was petting my dog in her waiting room by the receptionist, a nice lady with the bunnies in her backboard. 122, 142. So does this doctor say, oh my God, got to send you to a cardiologist? No. And I just realized this now, like, this is really horrible malpractice. Your patient has serious, serious heartbeats per minute, like in the stratosphere. And you're just going, oh, really? Well, let me file my nails. And so this is why we as patients really need to be very, suspicious. Suspicious is the right word about, what we have, what's treating it, whether the doctor is adequately diagnosing us. And I have to tell you, I'm a pain in the ass, and I've accepted this now. I see it as a good quality. I once got a homeless woman's car back in my volunteer work as a mediator. Like, she called me at 8:00 and I let a bureaucrat know that if he did not do this and like waive DMV paperwork, this is like magic acts, and like you get the toll fees paid by the city and everything, because they did this. They screwed up, the city screwed up, that I would annoy him until he died. And then I would annoy his children and grandchildren, that I would go back and annoy his ancestors. So I also told him she was really personally responsible. But, so you have to not be ashamed that, guess what? It's uncomfortable. You ask your doctor, I would like a second opinion. You're entitled to this by law. It's not rude for a second. This is your health. To be polite. We women tend to be high in agreeableness, which is, this nice quality where you care about other people and their feelings, and also where you're just complete people pleaser. You're like, oh, why don't I just give myself this disease to be like, not say anything? No. This is a great thing about being an older woman. You can just be this like mouthy broad.
I'm not going to sit here and deal with these symptoms because I'm dainty and petite, and that's just what I'm supposed to be dealing with. That's
exactly.
So accept, start banging a drum.
Except what's the cost of doing this? Okay, what do you have? 30 seconds of discomfort while you say, oh, I'd like a second opinion. Okay, can you handle 30 seconds of discomfort? Is it worth your life and your health to handle it? So yeah, just suck it up. Just say, I'm going to do this. And then after you do it, guess what? You got to give yourself some props. You pat yourself in the back. You were brave. That was awesome. And say it out loud, because it sort of works better. This is research by Easton Cross about saying stuff out loud. It's really, really important. You must do that for yourself. Be a pain in the ass, and especially in the emergency room. They're going to dismiss you. I have a post on this coming up where women's heart attacks are missed because we don't have the Hollywood heart attack where we clutch and drop. We might have indigestion or something else. And you ask to talk to a supervisor, being a pain in the ass. They're not going to, unless you're like, I don't know, like it's trying to stab someone. They're not going to arrest you. They're just going to give you the care you need. They might grumble a little, but guess what? That's done. They're not going to remember you like a day later. So just do it. You owe yourself and your health. If one person does that, be a pain in the ass and be proud. Be proud, proud, proud. So
Yeah, you're your best advocate. You can't expect somebody else to do it for you. So if it
exactly.
means taking a step into a direction that might be a little bit more ugly, then do it. I mean, it's worth it. I want to rein in some of the squirrels. Um,
I know. Honestly, yeah, it's always a thing because I'm so desperate to give women this information, and there's so much. And then
it's
I'm
so much.
we
It
gotta
really
say
is. It's
this
so
and
much
that.
information.
Yeah.
Yeah. So I want to go back to you were starting to talk about like a treatment within the that perimenopause phase. So when you were digging down into that research, what comes out as like the best course? I mean, I know it can't be for everyone, but
Oh no,
what
it is
like
for everyone. It absolutely
it
is.
is. So
It
then
is.
what would be the
So
best course
okay.
of action? That what questions maybe should somebody ask their doctor? Or
Well, okay. So what you need to do is to go in. You need to like women have had, and I saw this from you. Women actually, it's the greatest thing for me. They tell me I've gone and I've taken screenshots from your book, and I present stuff in here about how to approach your doctor to get them to partner with you, even when they don't know the care, to not approach them in a way where they feel demeaned, where you're not aggressive, where you treat them with respect. And that part of that is listening. This is a thing. I have a TED talk as a mediator where it's listening to learn instead of fighting to win. If you try to just shove your point of view down someone's throat, they're going to fight you. This is an aggressive act on your part. But if you present it to them and if you listen to them with respect, really listen, not that thing of like where you're like, and you're really like thinking like, I wonder what should I have for dinner? Like pretending to listen. They know, we can sense that, most of us, many of us, then that's one way to do it. And so in perimenopause, you have the problem. If you look at the physiological problem, this is what doctors are not looking at. It's all mysterious. If you know the physiology, we have a broken feedback system that happens at a certain point. This is from Jerry Lynn Pryor's research, excellent research, where our feedback system isn't properly responding. And so we have this spiking estrogen and then diving estrogen. And by the way, that's what causes hot flashes. You have an elevation of stress hormones when this is like a withdrawal effect if you're on drugs. It's very similar. And you have a freak out from the spiking and diving estrogen. And then you don't have progesterone being made because if you're not ovulating, and many of these cycles are not, you find that through the temperature taking, and ideally take more than 1 month. I always know this when they take pressure of my eyes, I have them do a test, retest, take the pressure. Would you mind, could you take it twice? And when I say, would you mind, I mean like, do it, like the exorcist, but I'm nice about it, and so I catch more flies with, well, actually a fly swatter, so never mind. But so progesterone gone missing, that's the thing where you are at risk. This is the really important part. If you don't make progesterone, you are at risk of breast and endometrial cancer. So this is a very persuasive argument. I like to use sleep because that was a thing for me. So wait, I can sleep on this drug, and and I had taken some, they wouldn't give me the full amount, and I wanted it, like that I'm sleeping so much better. And then I said, I got some prescribed by a friend, and I was taking the 300 milligrams, and I slept much better. And I did get that prescribed by a friend because you cannot just change your prescription and like take a bunch like this gets you in trouble. You want to not be seen as non-compliant with your medical plan. So, that you're doing what they say that you should do. And this is important to not be seen to be that way. I'm not going to say anything more, but on that level. But so progesterone gone missing in your breast. What progesterone does, it's like a wrangler for naughty cells. So you have these generic cells that can become anything. They can double and redouble into cancer. What progesterone does is it forces them to specialize, to differentiate into breast cells. This is like you give the delinquents a job. They got to like bag the groceries, whatever. And so they're not smoking pot outside by the dumpster or doubling and redoubling. This is vitally important. If you don't have progesterone, those cells can just run wild. And the same thing in the endometrium, which is the uterine lining. that you need progesterone to counterbalance the effects of estrogen. And this is why, oh my God, it is so important. Women, so if they don't have a uterus in menopause, and by the way, avoid losing your arteries and uterus if you can possibly do it. Ask. I talk about in the book the fibroids, the fallacy, the notion that that's going to cure anything. Removing these vital parts, you have all that. You're at risk of many diseases and bone destruction and everything if you get these removed. And so what you want to do is to have that progesterone, even if you don't have a uterus. Your breasts are protected by it. And doctors not knowing this, I just find this is like this enormous obscenity in terms of the negligence of that. And they don't know. They're not evil. They're really not. And doctors practice what's called defensive medicine. When they are ignorant of the drugs or side effects, they will overtreat you to protect themselves. That idea of first do no harm, guess what? It often applies to the doctor and their career, and you come second. And I hate to say that. And I have doctors I love, who are terrific human beings and everything. One of them is evidence-based, only one. Of all the doctors, I'm the endocrinologist and this and that and the hematologist, and I see that and I know that. And the bad thing is that I'm equipped this way. And I think that there will begin to be people like me who take on every area. My friends, Nina Teicholz, Gary Taubes, other friends have taken on the whole, the dietary science end of things. And really, Gary first, beaten up, he gets really abused by people. And Sander Greenland, who coached me, is friends with both of us, and he used Gary as an example. You be prepared, they're gonna come after you. And so far actually nobody has. My book's very well sourced, and also I'm humble. Part of being a person who is really a person of science is to not be overly certain. I get this from Sander, but also from my own reasoning and skepticism lifelong. And so my chapter on breast cancer, this is so horrible. I mean, when I'm writing this book, so much of this book, I have such a responsibility to be correct. And believe me, I've sent this out for fact checking and tell people kick my ass, tell me I'm a moron, anything, hit on anything. So the breast cancer chapter, I want to tell you, is there breast cancer risk from taking estrogen and progesterone? And you know what? I said, I'm sorry, I can't, because the research is too heterogeneous. So this group, they tested this kind of estrogen on these people and everything. It's awful. But Carol Sartorius and Catherine Horwitz, these pioneers, Catherine Horwitz, amazing pioneer in receptor research. What they say, and I think is correct, is that estrogen and progesterone are not themselves carcinogens. However, if you have existing cancer, they can run with it. And so I point that out. This is what I say in this chapter. Here's what we have. And then the problem is that women will die soon. 1 in 3 women will die of cardiovascular disease. And so it's 1 in 5 right now. And so women with breast cancer die of cardiovascular disease. Breast cancer is horrible. You don't want to have it. We all know people have had it. It's awful. And the chemo and everything, but 90% of it is survivable now. And, so the heart disease risk, it's so debilitating and horrible. What I said is, look, this is me. I'm giving you my story. This is not for you to follow because I have different individual health metrics. And I said, I don't have risk of gallbladder disease, et cetera, et cetera. I'm very metabolically healthy. Triglycerides 30, CRP of 0.3, if anyone knows these stats. Everything's, like that, except my LDL, and my doctor thinks I'm going to die. Hi, it's not oxidized pattern A, please.
That's okay. We know all about that stuff too.
I know you all do. It's just so tiresome. I love that they said I have familial hypercholesterolemia in my chart. Okay, that's a genetic mutation I don't have. I don't have any of this. So you have the xanthomas on my gross fingers. You would have these gross yellow fatty deposits. Sorry to say gross for anyone who has them. And a corneal arcus. You have this ring, and people in my family, they die. They don't die of heart disease. Grandpa climbed me as apple tree at 98. Okay. Yeah. Go away. And also there are some signs that this is protective. I haven't really looked at that. I just keep sending them things saying I don't have the evidence of this. Take it out of my chart, because what happens is other doctors, all these doctors just denied me an increase in my estrogen prescription I needed to get anywhere near a therapeutic amount. They're like, oh, you've heart disease risk. I mean, hi, look at the whole patient, not one number. I'm so
No, that's all we
metabolically
do. We
healthy.
just look at numbers,
I
and not even
know.
that. The doctors don't necessarily know how to read the numbers. They're just looking at the red and the
Exactly.
green and the yeah. That
Oh,
they
exactly. And
it's
right, it's
yeah.
just tested wrong. By the way, if they do the calculation for LDL, you guys probably know that it's wrong, for people on carnivore or low carb. There are all these, there's something just changed. It was like Friedenwald's wrong. You need the Iranian equation, but now it's something else. And it's just an estimate and everything. And you look at the metabolic health of the whole patient, just the whole thing is a mess.
I
So,
talked to Dave Feldman not too long ago on the show,
oh,
and
you
he
did
was talking. He was telling
wonderful.
about the research that he's been working on, and yeah.
Okay, I'm so glad you brought that up. This guy, he's the greatest guy. He's real Dave Feldman, or the real on Twitter. So wonderful, citizen scientist. And I put in my book, he has a nonprofit called ownyourlabs.com. Now, here's the nanny state government preventing us from being having.
My little card, my Own
Oh,
Your
that's
Labs
so
card,
great.
ready to share.
They're so wonderful. So, you can order labs. They're so much cheaper. He passes on the discounts he gets from ordering a large number of labs to the rest of us. But some states don't allow you to do it without a doctor intervening. Okay, so my doctor, there's not a doctor I have except the one who's evidence-based. That's my psychiatrist, gives me my ADHD drugs and everything. And I have sleep issues now in menopause. And so I didn't want to take Ambien and everything. So we did the whole test together. He's so great. But, all these doctors, they don't know as much as I do about, and I'm not arrogant in saying that. Believe me, I want to not be the genius in my medical care. I want to not be the person. The one thing I didn't know, I guess, that I needed an ortho appointment or sports medicine to have my tendons, my whole body, everything. I can't move my finger. My knuckles don't work. I was like this vibrant person who, I lifted 70 pounds of weight every morning, just like before I made coffee. I mean, running 20 minutes a day really fast to Motown, because that's my ancestral homeland. I would run at midnight if I hadn't run during the day, like, young lady, get your behind out there, because I'm disciplined, and now I can't walk properly because I can't balance. This is so
It's
egregious.
frustrating.
So these doctors, they don't know. The one thing I started I figured okay, they'll give me, the MRI. Oh no, they only MRI part of your body. Oh, the best was a plastic surgery referral I got. They're only going to treat my middle finger. And I thought, do you guys realize what a fabulous and horrible metaphor this is? Seriously? Yeah. So my toes, I don't
well,
feel
my middle finger's working just fine. So here,
I know.
have a look.
I could rupture my Achilles tendon, but we're going to just treat my middle finger. Oh, and they're going to give me cortisol. In fact, yeah, no, you're not. No. I don't care. I just need, it's so egregious. So I need a physical medicine referral. I didn't know that. I mean, and this is the level, and I'm telling you all this because here I'm a medical expert. I know all this stuff. I know all the ways to fight this in California. Escalations, expedited care. I filed a Department of Managed Care, complaint, IMR, expedited urgent. I put the diagnostic codes in there called ICD-10. I mean, I can't get this from the 7th to now, and I'm posting these really wonderful posts on social media. I did because I'm funny from childhood pain. No friends, it makes you funny, or maybe it's something else. But I do these visuals. I have this fabulous visual. There's Kaiser Permanente Thrive, so I did that, and I had it use the logo over. It's a morgue drawer with a toe tag on it. Your name here. And so this is parody, so it's permitted even though I use their logo. And so I'm going to put that. Oh, by the way, I have Substack. I'm going to send this out this week. Subscribers at amyalkon.net. That'll be the post. And that's the one about heart disease being missed in emergency rooms. And then next I'll do a informed consent, because people need to know this and spread this. And please, the way you spread, your dad with the fluoroquinolones, I love what you do. It's so important because you're telling people all this stuff, and they spread it and they spread it and they spread it. Think about how many people, if you ever have it starts with the S and ends with T, burger of a day. I hope that you remember to think here are all these people. They're not suffering. They're healthier. Their weight is healthy. They're happy because they're not suffering because of me. It's nice to reflect that. Let's just remind you of that.
Well, I have like a ton more questions. Do you have any? Are you okay on time?
Oh, I won't shut up. Yeah.
Okay.
No,
I
there's a,
just don't want to keep you longer than you're
oh
available. So
no.
start like flapping your arms if not.
Oh no, I
If
always flap my arms because I'm like a, excitable chicken. But no, there was, my joke is when people say something insulting, like, "Why don't you shut up?" And I said, the question, what will it take to shut you up, has yet to be answered.